I'm Dr. Brian Wallace from Somerset Hills Chiropractic, located in Bernardsville, New Jersey. I've been a practicing chiropractor over the last 10 years, and I truly love what I do. I get to help people feel better. And in this aspect, we're going to talk about, how we can keep you from having to resort to some type of medication that may not be in your best interest long term. So as a chiropractor, most people know chiropractors for musculoskeletal pain, low back pain, neck pain, headaches, and a myriad of other pain or symptoms related to the musculoskeletal system. But in the bigger picture, what we do as chiropractors is we look at people's spine and we compare it to normal. And the closer your body is to what is considered normal, not only do you feel better, but in the bigger picture, your body works better. As a chiropractor, we deal mostly with the spine, and your spine houses your spinal cord. And your spinal cord is your nervous system. And the nervous system is the most important system in your body. It controls and coordinates every other system in your body. So when that pathway is open and communicating properly, your body works at its peak. And if there's some type of misalignment or irritation to the spine, it will have an effect on the nervous system and therefore creating either pain, symptoms, and in other cases, it can create dysfunction. So that's kind of what we do. We encourage patients through natural health. We talk a lot about diet. We talk a lot about exercise. We talk about what's in between your ears. Having a positive mental outlook on life will have a huge impact on your health and your symptoms and your pain. So if you're looking at minimizing pain, start looking at the bright side of life, looking at the glass half full, because their studies show that people who have a positive outlook on life, an optimist lives on average 7 years longer than a pessimist. Crazy, but just changing your attitude makes all the difference. So we deal with patients who have had acute pain, some type of injury. We see obviously patients who have been in car accidents and things like that, which is more of an acute issue, or a trauma-related fall, sports-related injury. We do see a lot of those types of problems, but we also see in maybe a more of a elderly population, chronic problems, issues that have been going on for a long time that progressively get worse. And as the chiropractor, what we encourage patients is always start from a least invasive approach and move towards a more invasive approach. So less invasive approaches are chiropractic, massage therapy, physical therapy, acupuncture, yoga, meditation, things like that. And then if those areas don't help relieve your symptoms of pain, then you can move into more of the invasives, trying different medications and other therapies, the injections and things like that. And then finally, if things don't improve with those types of therapies, you can end up with some type of surgical procedure. Which obviously is a last resort. We always encourage that as a last resort, because once they start taking out things, you can't put them back in. Mm-hmm. So we always encourage that. And as chiropractors, about 9 out of 10 people will develop lower back pain at some point in their life. And 8 out of 10 people will develop some type of neck or upper back pain throughout their life. So there's a very good chance that you will have some type of musculoskeletal type of issue throughout your life, and seeking chiropractic care or a different alternative modality first, you have a much better chance at resolving that issue without the use of drugs, medication, or surgery. So obviously that's all dependent on the patient. Whenever somebody comes into our office specifically, before we do any type of treatment whatsoever, it's required a full exam, a history, proper consultation, and any necessary x-rays. We, as a chiropractor in our office, do have x-rays on site. So we can do that because we want to make sure we're doing what's best for the patient. It's not just, we want to help you feel better as quickly as possible. That's our number one goal, but we want to make sure we're doing what's in your best interest. And a majority of the patients that we see within 1 to 2 weeks will tell us that they notice a significant difference. If it's a more chronic, if there's a lot more arthritic conditions going on and something that's a little bit more tricky, sometimes it's up to a month, but never more than a month. And most patients notice a significant difference in the first 1 to 2 weeks. Anyone with Medicare, chiropractic care is covered very well. You get up to 30 visits a year, which is a tremendous amount of visits to be covered by Medicare patient. And so Medicare patients coverage is very good. And if you do not have Medicare and it's some type of insurance, then it's totally dependent on the policy. Most policies do have some type of chiropractic coverage. Chiropractic is becoming more and more mainstream today, and that's always a good thing because it prevents people from having to seek more invasive procedures. Finding a good chiropractor can be tricky, just like with any other medical professional. There's good ones and there's bad ones. And the first thing I would do is ask around. Ask around to your friends, to your family members, or people who live within your vicinity to see if you can get a recommendation. See if you can get a referral from somebody who's already had a good experience. And once you do that, the next thing I would do is look them up online. Most today, if you have the ability to access people online, you are going to see reviews. You're going to see how they rate towards in comparison to others. And now that's not the tell-all whether or not somebody's going to be good for you. And then call them up. If everything looks good online and you've got a referral from somebody that you trust, give them a call. Ask them about their procedures. Ask them to talk to the doctor. If anyone ever calls this office and would like to speak to me about what's going on with them before they make an appointment, I'm more than happy to do that at no cost to the patient, just to help them feel more comfortable and make sure they know that they are in the right place. So if you can do those 3 things and you still feel good about it, you're probably in the right place.
I am Christy McCarthy. I have been a physical therapist now for over 25 years. I've currently been working in the same physical therapy office for just over 10 years. So some of you may have had experience with physical therapy and some of you may not. Physical therapy is, I would say the background of it is based in Western medicine. So we are very much aligned with your doctor's recommendations and everyday healthcare that you would find here in the US. A physical therapist is a licensed professional. We have all gone to some sort of postgraduate schooling, graduate school. Currently, if you graduate from physical therapy school, you graduate with a doctorate degree. It takes usually 3 to 4 more years than just your undergraduate degree. We are required to keep up with continuing education. So we are abreast of current scientific studies that help support some of the things that we do. And we try to, make sure that it has a good basis in science for why we do the things that we do. Physical therapy runs on the continuum of the full life. So we do see infants and school-age children. We also see young adults, kids who have sports injuries, and we see middle-aged adults who might have sustained an injury for whatever reason. And we also see the elderly population. That happens to be the area that I specialize in. Definitely work with a lot of the frail elderly or people who just want to maintain how they're doing in life or improve upon their status. We see the area of physical therapy that I work in is outpatient orthopedic therapy. So we deal with the musculoskeletal system. By that I mean musculo meaning the muscles, and obviously skeleton, the bones of the system. There are other physical therapists that are based in neurology. A neurophysical therapist would help you if you had Parkinson's or you've had a stroke. We do treat some kinds of neurological issues in my clinic. I'm also trained in a specialized area of physical therapy called vestibular therapy, which deals with balance issues or balance dysfunctions that are stemming from issues of the inner ear. Pain is the primary reason that we have patients come to see us in our clinic. So if pain is impacting your function, if pain is making it difficult for you to live the life that you want to live, that is a great reason to come to physical therapy. You might have pain because of a chronic issue, and by a chronic issue, this could be arthritis, an arthritic knee or an arthritic hip or arthritic shoulder. You might have issues of pain that are stemming from issues in your spine if you have spinal stenosis, or you have a degenerative disc in your neck or your low back. That can also create some chronic pain issues. We also deal with patients who have acute pain issues. And by acute pain, I mean pain that has started up maybe in the past few weeks to last couple months. That would be considered acute pain. Chronic pain is pain that you've been battling for months to years. So acute pain, that might have come because you started a new exercise program, or you suddenly had to do a lot of heavy lifting, or you engaged in some heavy gardening and you've developed an overuse injury. That would be an issue that we certainly could help you with. We also see patients who are post-op surgery. So if you've unfortunately fallen and sustained a wrist fracture or an ankle fracture or a hip fracture, you would probably be referred to some sort of physical therapy for that. If you've had a total knee replacement or a partial knee replacement or a hip replacement, or you've had rotator cuff surgery, all of these are definitely cases that an orthopedic doctor would be referring you to physical therapy. And so in all of those cases, chronic, acute, or post-surgery, you're likely to have pain, and physical therapy is designed to help you to try to manage that pain. How do we do that? So what happens if you come to physical therapy? You would come to our clinic and you would undergo an evaluation. And during the evaluation, we try to look at a patient in a very holistic manner, meaning if you have low back pain, I'm not going to address simply that small area of the back that is causing your pain. I'm going to attend to that, but I'm also going to look for what are the causes of this person's low back pain. Is it stemming from an overuse injury of the muscle? Is it because, unfortunately, they've had poor posture for many years now, and that has worn down on the skeletal system and created some changes in the discs that we need to address? Is their low back pain related to maybe a leg length discrepancy that hasn't been observed yet or problem solved? Is it related to a scoliosis of the back? So we try to look at the entire person. As we say, it's sort of a chain of events. It's not just one area that hurts. It's related to all the parts above and below. Same thing if you came in with a shoulder pain, I would be evaluating, is it your neck that is referring pain to your shoulder? Is it your shoulder because of a postural abnormality? Is it your shoulder because of a weakness or stiffness in an area of the shoulder? How do we treat the pain? We have many options in front of us. So the simplest thing that we might do would be to recommend that you use heat or ice. I want to tell you that ice is your friend. Ice is a very nice way to calm down an inflammation of a body part. It's either going to help you or it's going to do nothing, but it really can't hurt you unless you give yourself frostbite or freezer burn. So you do need to be careful and listen to your body, but 10 minutes of ice on an achy part is never a bad idea. If you come to our clinic and we felt that you would benefit from a modality called ultrasound, we might use a small machine, contains a little sound head that creates vibratory waves, and that friction in your tissue is used to warm up the injured tissue. So when I warm up a tissue, I help bring blood supply to the area. That helps with the healing. It helps to flush out any toxins that we might have from cellular death from the injury. I might be using ultrasound to prepare a tendon or a muscle for stretching. It's just a way to deep heat something. You may have also heard that sometimes we use electrical stimulation. That sounds scary, but it isn't scary. Electrical stimulation is a way to actually tell the brain to stop sensing pain. It's a way to block our pain pathways and to give them a different message. So instead of constantly saying pain, they now are feeling a different sensation. They even have on the market portable small units of electrical stimulation that's called a TENS unit. So it's one that you could use at home, and you have your own electrodes, and we can teach you how to use that for a chronic pain issue that might be helped by that. We've begun in the past few years utilizing something called kinesiotape. You may have seen kinesiotape on some of our Olympic athletes or on a local athlete at your local high school. Kinesiotape is another way for us to give your pain pathway a different sensation so that it's not constantly saying pain in your brain. It can help make things feel a little bit better. If we found that a source of your pain was related to a stiffness in your joint, we are trained in joint mobilization. So I might need to loosen up a shoulder joint with some gentle motions to try to gain flexibility in that joint to help restore more normal motion. If I found that you had tension in some muscles or some muscle knots, we utilize massage for that reason. So we might find a trigger point and we might work at trying to release that trigger point and restore more normal muscle motion. Finally, the other ways that we might approach pain for physical therapy, if I found that you had a joint that was too tight, or a muscle that's too tight, I would certainly address this with the proper ways of stretching. We would teach you how to stretch. And oftentimes pain is related to weakness. So one of the major areas of physical therapy is teaching you the correct ways to strengthen your muscles. By visit number 6, I absolutely expect a patient to tell me that they think that we are on the right path. If I haven't heard that by about visit number 6, I need to rethink what I'm doing or perhaps refer you back to your doctor. The first person to ask would be your friends. Perhaps some of them have come to our physical therapy clinic, or ask your doctor. If you have physical therapy, our clinic does take insurance. So if you have Medicare, we have to work in conjunction with your doctor. We need to work under a prescription from your doctor. If you don't have Medicare, we are direct access, meaning you can come to our clinic without a doctor's prescription. If we feel you need care from a doctor, we will refer you to a doctor. Like normal insurance, if you have a deductible, that would have to be met. There are co-pays associated with a visit if that is part of your insurance. And then some insurances cap the amount of therapy visits that you can have in a year. So you certainly could get started with your insurance. And we do try, one of the things that we try to do is to teach you how to help yourself. So my favorite day is the day I say, bye, I hope I see you in ShopRite, because I want you to feel empowered that you can help yourself. I don't want you always having to come back to me for your pain. I want to teach you how to make yourself feel better and empowered by that.
My name is Jennifer Husnick. I am a licensed massage therapist. Been working in the field of massage for about 25 years now. I guess in the 25 years I've been doing massage, I have been working about most of the years, except for the first 2 years, I've been working with doctors and doctors' offices. So the type of massage that I do is a little more medical, not so much spa, fluffy kind of massage, which is also very nice. But my type of massage is more specific to injuries, pain management, which also helps to relax the person, de-stress, and boost your immune system. So that is very important for this time, specifically with all the things that are happening, viruses and things like that. Boosting your immune system, keeping healthy, keeping de-stressed. It all goes with the massage therapy. Because touch actually releases pain relieving endorphins throughout your body, that is very helpful in relieving pain. Just knowing somebody is caring for you, knows what they're doing, and the intent that we have as a massage therapist is to help you feel better. Sometimes that goes a long way. Also, when we're working on certain muscle groups that are in spasm or causing pain, just bringing that blood flow to the surface, pushing out all the metabolic waste and toxins that are stuck in the muscle to help release all of that, that helps the pain as well. It can be a little bit uncomfortable at times, but we always say it's kind of the good pain. And that's how we know we're working on an area that really needs it. So day to day, headaches, or I slept wrong and I can't turn my neck, that kind of thing. Very good for specific injuries like that. Because I work in a chiropractor's office, we work on a lot of chronic pain as well. So getting massage on a regular basis can help people who have like chronic issues with their lower back, maybe their muscles are weak, and so other muscle groups have to tighten to counteract the weak areas. So we work on the other muscles, get them to loosen up, and everything kind of goes back to where it should be. So it helps in, any which way, chronic or acute injuries. A lot of the patients, that's their number one question. When am I going to feel better? Everybody's very different in how their body receives and reacts to massage. So most of the time, there's some slight difference right away. And again, I think that's because of the endorphins that touch it, you getting touched, and that caring for somebody, they're feeling that, and that's a big part of healing. But then as they, some people, their muscles are very, very tight for a very long amount of time. And I always say they're kind of like a stubborn, naughty 3-year-old. They don't listen sometimes, the muscles. So you have to keep going consecutively to get it worked on. So you relax the muscle, it kind of listens, and then it might just tighten up again and say, we're not going to listen to this therapist. And then you go back in, you get it worked on again. Everybody's slightly different in what their body can handle as well. Like the deep tissue, not everybody can handle deep tissue, and you have to kind of go with what your patient or client can handle. There's some people I want to just get in there and just work on those spasms, but immediately I can tell their muscle tissue just tightens right up. So I need to back off and just go easy, easy, easy. So, but most people can feel some type of difference early on in their massages. You would want to look for somebody obviously who has a license. In the state of New Jersey, it is required now. States differ, you know, everything is different depending on what state you're living in. I would also look for somebody, well, it depends on what kind of massage you want too. There's so many different kinds. You know, if you're looking for a very relaxing spa massage, they still have to be licensed in a spa. You know, you can go that route. If you're looking for something specific to an injury, rehab, or something like that, you'd want to go ask a physical therapist. They might know. I have a couple of physical therapists that will refer their patients to me for massage. Ask a chiropractor. Like I said, I've always worked with chiropractors, and I've actually worked with a group of neurosurgeons. You can always ask around, you know, your other medical professionals where they would want to send you. We found in our office that there are some insurance plans that will cover, I believe, like a 30-minute session, as long as they're getting an adjustment with it. It's considered trigger point therapy. Most insurances do not cover massage, unfortunately. I think it's because insurance companies can't really keep track of where the person's going to get the massage. There's no like big database of like, okay, all these therapists, you know, you could take your script and go and get it covered. I also think it's kind of a blessing that they're not paying for it, because once insurance companies start to pay for things, they start to dictate what you can do and what you can't do. And, you know, massage is so specific to the person giving it that it's hard to say, well, you can't, you know, the insurance company says I can only work on this trigger point for X amount of minutes, and then I have to go somewhere else, or I have to do, you know, something different. So we as massage therapists have our own style and technique, what works best. And I think insurance companies might end up trying to dictate a little bit more what we can do.